Huntsville Hospital reported this week its COVID-19 patient volume is at 95 patients system-wide. But since the 4th of July, the Alabama Department of Public Health is reporting a 27% increase in COVID positivity testing rate. Thank you for joining us for News 19 at 10. I'm Emily Forrester.
And I'm Greg Screws. And the Alabama Department of Public Health warns that as positive COVID numbers continue to go up, there is yet another variant with which to contend. News 19's Archie Snowden's live in Huntsville Hospital and has more from the Alabama Department of Public Health.
And Greg, the ADPH says that those new subvariants have the unique ability to evade immune protections, meaning that as the state of Alabama continues to rank near the bottom in total vaccinations, the ADPH says that COVID-19 isn't going away just yet. Which means we are still not out of the woods yet.
The virus is doing what it does. It's trying to escape our immunity.
Dr. Wes Stubblefield of the Alabama Department of Public Health says that we are seeing about 100 cases per day during the spring months, but now there's reports that just under 200,000 cases per day, and Alabama has seen a 67% increase in COVID positivity rate over the past 30 days, and that's not counting the unreported cases since the 4th of July holiday weekend.
The percent positivity of the test has continued to rise week over week. Now we're just above 27-28% on those, and our hospitalization numbers have continued to increase, and now we're somewhere just above 515, 520, something like that. So numbers and COVID activity across the state has just gradually risen over time.
And although the increase in cases doesn't appear to approach the meteoric levels of previous waves, Dr. Stubblefield says the Omicron subvariant BA.5 has become the dominant strain in the state. Folks in households who have avoided COVID thus far have contracted the virus.
COVID is still real. It's still worse than the flu on average. Most healthy people do fine, but people that fall into those high-risk conditions have serious risk of going to the hospital and getting very sick. And that's why we want people to be vaccinated, why we want them to know that there are therapies for people who get COVID and how to get to those therapies.
Dr. Stubblefield adds that only 700 children between the ages of 5 and 11 have received the COVID vaccine in the state of Alabama. And as we mentioned earlier, that the state of Alabama continues to rank near the bottom in total vaccinations in the United States. For now, we're live at Huntsville Hospital. Archie Snowden, News 19.